The sounds you are hearing, the music being played right now, this is a tailored fit PT creation. I made the music, Ryan consulted on the vibes. He's a producer, engineer. I'm the engineer, musician. We made this song. Let me know what you think of it. And it's funny because we can't hear it because we have to edit it in, so it's a little awkward, but I assure you it bops, Ryan. It's a freaking good song. Speaking of good songs, today we're talking about how to train your knees for longevity, a little bit of rehab, a little bit of strengthening, and a little bit of stories. So if you don't know, I don't know if you know about this stat here. Nearly 20% of Americans 45 and older have knee arthritis. Worldwide, the number is predicted to increase nearly 75% by 2050 because of aging, population growth, and obesity. What do you think of that stat there, Ryan?
Scary. And today we're going to be talking about how to mitigate that, how to get rid of some knee pain, how to train around knee pain, how to strengthen your knees for longevity.
Yeah, and I think it's like a kind of a scary topic for some folks. Like knee pain can be pretty scary because every step you take, you feel the pain, usually. And it can be debilitating, right? Like even as something as easy as going up the stairs, down the stairs, even like sitting down and getting up from the toilet, which is like you need that stuff. So we're here to kind of hopefully give you some confidence when it comes to knee pain. If you're experiencing knee pain right now, give you some confidence that this is not a permanent thing. You can 100% decrease the pain, and there is a high likelihood, depending on your age, training history, what's going on in the knee, that you can fully get rid of it. Let's dive in with a little story. I want to talk about one of our old clients. Her name's Biz. She was a lifelong hockey player. So playing hockey her whole life. I think she played in college. There's some, maybe some like lower level professional leagues, things like that. And she was a goalie. And if you know anything about goalies in hockey, they're basically like doing a quarter squat the whole time, like staying low to the ground to be able to catch the puck and all that stuff. Ryan, is a hockey, do you call it a hockey game or a hockey match? Which it's funny that you're wearing a Sharks
I know, right?
hat too.
Yeah,
That's
go
good.
Sharks. No, you could do whatever. Call it a game.
Game. All right. So basically, just to give you a background on her, Biz was in her early 30s when she came to us. Debilitating knee pain. Anytime she squat, she had to squat basically. So her goal when working with us was, hey, I want to be able to squat without knee pain, and ideally get through a whole match, not necessarily without knee pain, but to be able to play a whole match and not be carried out in a stretcher afterwards. She had been at that point experiencing knee pain for a pretty long time. So I would call it chronic. Usually when it comes to like acute or chronic pain, you classify it by time, right? So if the pain is something you felt for less than 12 weeks, it can be considered acute. And if you've been experiencing the pain for longer than 12 weeks, we're going to go ahead and classify it chronic. And so she had chronic knee pain. Some of the things that she did in the past, she went to the doctor, she did conservative physical therapy, so some like band work, massage, ultrasound, STEM units, to try to get some engagement. And the physical therapy initially helped the acute pain, so it got her back to doing activities of daily life, like sitting on the toilet and going up the stairs, walking her dog. She had two really super sweet, cute dogs. But it didn't fix that underlying issue, and it wasn't enough to get her back in the hockey rink. So when she came to us, she was a little desperate, and she's like, hey, I want to actually fix the underlying issue, and I want to get back to playing hockey games. So our approach, this is kind of our approach across the board. We don't necessarily just look at the knee. It's a whole body approach. When it comes to the biomechanics of the body, a lot of the times pain in a certain joint can be influenced or caused by pain in a joint above or under the knee. So we look at the hips, we look at the spine, sometimes we even look at the shoulder and the neck, but most of the time we're looking at the lower back, pelvis, hips, the knees themselves, and then the ankles. So what we do is we do a full mobility and strength assessment on all of those joints and then the surrounding muscles and tissues that accompany them. And basically with Biz, what we saw is that she lacked external rotation of the hips. So if you are maybe not an expert at kinesiology, external rotation of the hips is basically like if you are sitting on a chair and you take your ankle and you put it on the opposite side, on your thigh, on the opposite thigh, and then you bring your knee down towards the ground. That's hip external rotation. Or when you're sitting down cross-legged and your knees are coming down towards the ground, that's part of it is hip external rotation. So we found that she was super tight in that position. So her outer glute, we found that her inner thighs were also super tight and her ankles lacked a ton of mobility. So there were some clues there. And then we saw that she had pretty weak glute stabilizers. So when it comes to your thick, awesome, beautiful booty, it's not just the giant cheeks that we're thinking about. Damn, dude, gotta get professional here. It's not just the big glute maximus muscle that we're thinking about. There's a layer underneath that has these smaller glute minimus, glute medius, piriformis stabilizer muscles. So they're in charge of just stabilizing the pelvis and in turn stabilizing the knee and the ankle. So we found through some tests that her stabilizers were weak. And then there was a very big asymmetry when it came to strength between her left and right legs. So those were the clues. And we just got started. So we just assigned her some mobility work to fix that external rotation, the inner thighs, and the ankles. And then we did a ton of strengthening, not only the small stabilizers, but just finding ways to strengthen her big leg muscles without flaring her knees, which is a big problem, and we'll talk about later. Ryan's going to touch on that. So one big problem I think people face when they have knee pain is like, all right, which exercises can I do at the gym safely that will elicit a good workout and get me going, build my muscles? Because that's what they tell you, right? Like very basic is like, oh, your knees hurt, you need to strengthen the muscles around the knee, you need to strengthen your legs. But they don't ever tell you how to do that without re-injuring or making the pain worse. There's an art in that, and it's not the same for everyone. So anyways, we did all that stuff. And then the biggest thing too when it comes to pain is figuring out what makes the pain worse. And whatever that activity is or position is, we scale it back by at least 25%. I rarely say to fully cut out something, especially like, great example of this is runners. You know, we'll have runners come and work with us and they're like, oh yeah, doctor told me to stop running, physical therapist told me to stop running. And back in the day, that was kind of the baseline gold standard advice. Now we have a lot of evidence to show that you don't necessarily need to stop doing activities. And if anything, it's counterproductive because when you stop moving, you decrease blood flow, you decrease circulation, and then you stop taking away the stimulus that your ligaments, tendons, muscles, and bones need to continue to heal and grow. But there's a perfect amount of that. It's almost like baking. Like you got to figure out how much is appropriate and how much is too much that will make you fall into pain again. So we did that. After a few weeks, she was back to squatting pain-free. Obviously, it sounds super simple, but there is some things that we'll dive into that allowed her to get there. But the biggest thing is to realize that when it comes to training your knees for longevity, your knees are not super sensitive, right? Like I think a lot of people are scared to hurt themselves when it comes to their knees, and they get advice like running's bad for your knees, squatting's bad for your knees, going knees over your toes with lunges is bad for your knees. There's so many things that are bad for your knees, and then some things that people say that are good for your knees I don't think are like, they're good for your knees, but they're not as beneficial. So the point here is like when it comes to the knees, it's rarely about the knee itself. You got to look at the hip, the spine, the ankle, come up with a really awesome stability, mobility, and strengthening program. Take away the things or scale back the things that hurt you, and then slowly move your way up back to baseline. And then eventually you're going to push through and build resilient knees. That's what we did with Biz. And I know that, Ryan, you have also another client that we worked with who had sort of a similar journey, but a little bit different. You want to share what you experienced?
Yeah, 100%. So I'll talk about our client Alexandra, and actually she came to us. You were talking about running, so this is a perfect example of that. Basically, she came to us being like, I want to run, but when I try to run, I get this knee pain. And so basically, what she did was just she kind of stopped, which is a good thought. You're like, okay, well, that is hurting my knee. Obviously, I'm going to stop doing that. My grandpa would always say to us, like growing up, he'd always be like, if you were to go to my grandpa and say, Grandpa, it hurts when I do this, he would say, well, stop doing that. I always like laugh about that. I always think about that, but it's a good thought, right? Uh, but it sucks. Like she obviously wants to run. It's important to her. It's fun for her, and so she came to us. And I'll just go ahead and read off a little bit of her intake form. So she basically said, "My goal is to overcome my knee discomfort so I can get back to leisurely runs. I want to get fit, improve my overall fitness to help my confidence, and be able to finally run again." She wanted to improve her mobility and stability, lose weight in order to prevent injury and live healthier. And she was basically saying, I'm too young to be having knee issues, and I need the right guidance to help me achieve this goal. And so we went through the mobility assessment. And what is interesting is I didn't see anything crazy, no crazy limitations. Range of motion was good. Honestly, no pain even when we were doing the assessment. And so what that told me is, okay, from your example, Milad, and your story with Biz, her problem was chronic because it was over time and it was lingering. With Alexandra's pain, it was more acute. So it would happen like after a run. So that gave me some insight. So what we did is we started off doing some daily foam rolling and stretching. So we specifically foam rolled quads, her lateral quads, calves. We stretched the quad. We did a side bend stretch, a calf stretch, and then we did some sideline hip abductions. And it's exactly what you mentioned, is you want to kind of stretch and strengthen the joints surrounding the knee, like above and below. So we have the hips, we have the muscle that is connecting the hips to the knees, the quads, stretch the calf that is connecting like the back of the knee into the ankle, strengthen the calf muscle, things like that. So we did, just to reiterate, we foam rolled and we stretched daily. We also gave her a pre-run like mobility kind of session. And so before her runs, we would do some hip adductor stretch. We would do like hip swivels. We would stretch her hip flexor. We would do the world's greatest stretch and then some calf raises. Then she would go on her run. So we made her a plan that she would run 3 times a week. And we basically did like load management. So we didn't say just go run a mile straight from the gate. We set her up with that couch to 5K plan. So, which is really good with load management. And when I mean by load management, it's like you're gonna jog a little bit, for a minute and a half. You're gonna walk for a little bit. You're gonna jog, walk. So, just slowly increasing the load and volume of impact on that knee joint over time. So slowly and surely, we built up a run. So she was running 3 times a week, stretching before the run, stretching every day, doing mobility work every day. And then we had post-run mobility work. So we were doing a hip external rotation stretch. That's exactly what you were talking about earlier when you're sitting down and you put your ankle on the opposite knee. You're stretching that hip external rotator. We did a hip internal rotation stretch, a hip flexor stretch, hamstring stretch, and a butterfly stretch. It's basically stretching before and after her runs. Easy kind of runs, like increasing our volume and demand over time. And then we also had her doing resistance training 3 times a week. So I set her up, full body lifts. Her goal is not just to run. Her goal is just to be in shape and to feel good, to feel confident with her runs and get rid of that knee pain. So phase 1 was kind of like, okay, let's lower the volume, but not completely get rid of it, because that was her mindset was, let me stop running, but I know that I'm not going to stop running forever. So she was smart. She reached out to us and said, help me with a plan. So we did load management running with the jog plan, resistance training 3 times a week, full body lifts. So we were doing things like split squats, lateral step ups, bridges, some core work, some calf work, hinging work, hip abduction work, things like that. And we just progressed it over time. Also set her up in a calorie deficit because she wanted to lose some weight. Talked a lot about protein and healthy habits, got her fiber set up, and that's a big part of it too, is nutrition, because we wanted to lower her inflammation in her body and help her recover from her exercise plan. Because before it was a lot of kind of like, fast food, and just foods that are inflammatory foods. So we talked a lot about that and how to have more whole foods in her diet. And like I said, set her up in a calorie deficit, because a big part of her goal was weight loss. And we also worked on stress reduction too, because her job was really stressful. So we talked to her about like journaling, meditation, kind of like a pre-bed routine, and just honestly, sometimes even just having that conversation and bringing it up and be like, okay, look, like you're freaking stressed like every day of your life, like that is actually going to increase your pain and like sensitivity to the pain. So if we can lower your inflammation via nutrition and just some like easy breath work, daily simple easy breath work, and just being aware of your stress and like taking it seriously, you're going to see some good results. And it's kind of cool that we can talk about that in relation to knee pain. But after her first 12 weeks, she's like, I'm feeling great. Knee pain has subsided. She could easily run a mile, and we got her up to eventually to 3 miles easily. When she came to us, she was weighing 160, so her BMI was technically overweight, and now she's at 130. This is it's been about a year training her. Actually, we celebrated her 1 year training with us, but now she's at that 130, so she's in that healthy weight. She has sufficient muscle mass, and she's just feeling healthy as ever. So she's good in the hood. That is an example of one of our clients that came to us with knee pain, and it sucks because she was feeling like, I can't run. She hit us up and she's like, I want to run. So that was kind of the program that we set her up with.
Dude, bravo, man. That's awesome.
We did it.
And it's like, if you're listening to this and you're like, wow, it was like kind of a lot of things, and it's like, yeah, that's kind of how it goes. And that's a perfect example of how pain can be multifaceted, and sometimes there's not a very obvious reason if you're not someone that's been, coaching people through it for a while. I think, both of us, obviously we're very much into our strength and mobility assessment or our body assessment, but like sometimes you don't really find anything. Like they're strong, they don't have pain during the assessment, and then you have to kind of open up the layers a little bit more, right? So you're like, what are you eating? When does it hurt? How's your stress? And most people are like, oh, that's some like pseudoscience bullshit, but actually it's not. Like pain science tells us that there are so many factors that can influence your pain. And I'm actually just going to read this off of Rehab Science, one of our favorite books on rehab, pain management, all that stuff. You guys should check it out. But basically, like some of the factors that can influence pain: sleep, your thoughts and your beliefs, movements and biomechanics, physical inactivity, your mental health, your stress, your diet, even your culture, the meaning of pain, anatomy, touch, posture, social interaction, and humor. You'll experience less pain if you're laughing, or if you're having a good time, you're not thinking about it. And then genetics, environment, and history. Even before this, Ryan, you were talking about how you were doing the front squat today and you were going pretty heavy, and you've hurt your lower back in the front squat before, and you're like going into the end of the rep range, and you're like, oh, I could probably do one more rep, but my mind is telling me no, because you had the trauma of the association of, oh, last time I went this hard and this heavy, I got lower back pain, which is also something you can definitely overcome, right?
Yeah, I mean, your brain is smart. It wants to protect you. So when you have a previous injury, it takes time to tell your brain, okay, this movement that we have modified is actually okay. It's okay. So it takes time.
Yeah, it takes time. And again, something we want to hone in on here and maybe repeat over and over again, and you're going to hear us repeat this a ton of times in these podcasts, especially when it comes to pain. Number one, your healing is not going to be linear. Like, you're going to have days where it feels good, and then you're going to have other days where you feel like you took 2 steps backwards. But understand that the overall trend is going to be moving in the right direction if you're guided the right way or you're doing the the right things. And just take it slow and believe that you are capable of healing and your tissues are capable of healing. That's the beautiful thing about the human body. We're just designed to get better and to adapt over stress. Obviously, it has to be the right dose, the right medicine, if you will, but just understand, and you even have to tell yourself, like, hey, I'm going to get better. I'm going to get better. I mean, even me, like, I think I'm at this point in my life with fitness and pain and just experience and knowledge where, like, I can discern between good pain and bad pain. And if I have some sort of injury that's like kind of nagging at me, I know when I can dial it back, and other times where I can definitely push through this. Like, I have this lateral ankle pain that I've been experiencing, and I know that it's from running like 11 miles in a shoe that was way too tight for my foot. And it's been kind of a thing that's been bothering me for maybe 2 to 3 weeks now. But it doesn't hurt when I run. Like, I'll start off my runs, it hurts a little bit, but then after like 2 miles, it warms up and I don't even feel it. It only really hurts like in the mornings and sometimes when I'm walking around. So to me, I know that that's good pain, and I'm going to continue to like run 12, 13 miles in a good shoe, and I'm going to race this weekend. And eventually, when you get a better understanding of pain, it's almost like jazz. Like, you can improvise around it and really listen to your body. And that's a big thing, at least I advocate for, and I know you do too as well, Ryan. I think you're intuitive about this. Is like, you have to get good at that. You have to get good at knowing what's good pain, what's bad pain, what can I keep doing, what do I need to hold back on, what's missing from my life, do I need more sleep, do I need to eat better, do I need to decrease my stress, what's going on to elicit these issues. And eventually, the more you practice and the more you learn about pain management, or you work with a coach that's really good at that, or a physical therapist, the better you get. So I highly encourage you guys to dive into that. Do you feel like you have that intuition with when you feel pain or like aches, nagging stuff?
Yeah, 100%. My issue in the past has been like low back pain. And like you brought up, I was doing front squats the other day and just kind of felt it a little bit in my left lower back area. And there's levels to it, so there's a lot of questions to ask yourself. How intense was that pain? How long is that pain going to last? Because now it's today, like I don't feel it at all. So we're all good in the hood. You know what I mean? But if it lingered, I might modify something a little bit the following week. Maybe we'll do one less set of it. Maybe we'll modify the load. But it's interesting too, because what we were talking about earlier is like your brain is smart, and it's going to tell you to like, whoa, like don't do that. But sometimes it's like that, the brain, that sensation and that thought, it's like overdoing it. And like kind of what we're talking about now is that it comes over time. The longer you lift and the more you expose yourself to different loads and stuff like that, the better you get at kind of being more intuitive. Because a lot of the times it's like, well, I felt that exercise in my knee, and it's like, okay, well, what does that mean? Like, how intense? Like, we did a split squat. It's okay to feel that in your knee. Like, how intense was the pain? Yada yada yada, and then you can discern what to do about it. But yeah.
Yeah, 100%. It becomes intuitive, and sometimes feeling exercises in your joints is totally okay. And I would say, just like, if you have no idea what any of this stuff even means, or you can't even like fathom how to start being intuitive with this, a good guideline when it comes to pain or pressure is like, if you're feeling it within an exercise and it's like under a 5 out of 10, the pain or the pressure, and then you say you stop the exercise, the pain goes away, that's fine. We're totally okay with that. Another scenario is you do it, the pain lingers a little bit after the exercise. I would say, just if you don't have any guidance or a coach with you, just decrease the weight, slow it down, or try a new exercise. Other times, this is kind of like the third level. It's like, you do it, there's some pain, there's a little bit more after the set that you do, but then it kind of goes away once you switch the exercises. And then the next morning you wake up, there's pain, then that's a clear signal that your body didn't recover from whatever that stimulus was. So to dial it back, or sometimes you wake up and there's no issues, there's no pain, then that's a clear sign to continue. Sometimes you have to push through that pressure and that pain, especially as you get older and older. Those aches and pains during exercises are totally normal. You just have to know when to dial it back or when to keep moving forward. And I think this is a good time to kind of interject with a study, especially a study that looks at exercise and knee pain. Because, we were touching on this before, but there's a lot of like fear mongering around certain exercises when it comes to knee pain, like running or lifting weights. We dug up a pretty massive systemic review and meta-analysis that actually came out in 2025. So this is pretty recent. And basically they looked at 217 randomized control trials with a total of 15,000 participants. So that's pretty freaking good. What they compared was different types of exercises. So aerobic exercises, flexibility, mobility, mind-body exercises, which is in the study classified as yoga, tai chi, neuromotor exercises, so balance and coordination stuff, strengthening exercises, and then we had a mixed exercise group, so a combination of like yoga and running or yoga and strength training, and then a control group with people doing no exercises for their pain. What they measured in the studies was pain, function, and when it comes to function, it's your ability to do your daily activities, going to the restroom, sitting up from the couch, gait performance, how biomechanically efficient you are when you walk, basically like your walking posture, your quality of life, and then just safety in general. So, checking in on your metabolic function, your heart rate, your blood pressure, things like that. And basically what they found, and this is kind of interesting, it sort of goes, I wouldn't say goes against what I believe, but it kind of made me be like, oh, this is something new. This is like an interesting conclusion. In the short term, what worked the best for knee pain was aerobic exercise. So it found the largest improvements in pain and quality of life. And the aerobic exercises they were doing was a lot of like very low impact, slow jogging or walking, swimming, cycling, rowing, things like that, which kind of makes sense because to me, those types of low impact cardio activities, you're improving circulation, you're improving blood flow, you're decreasing your cortisol, you're improving your mood without really like bending or extending your knee too much or under too much force. So like you're getting the benefits and you're not stressing it out. So that makes sense that there was a lot of improvements in pain and daily and quality of life. The other ones were mind-body exercises, so the tai chi, the yoga, and then neuromotor exercises, the balance stuff. That was for the short term. Midterm, again, we see aerobic exercise doing well, but then this is where the strengthening exercises come. So the strength and the aerobic were head-to-head tied up when it comes to the midterm, and that's after 12 weeks, which kind of makes sense because when we assign strengthening exercises, it takes at least 6 weeks to get those neuromuscular adaptations for your muscles to start firing correctly, for the muscle fibers to get bigger, for your bones to start increasing density, for the tendons to start building that resilience. So that starts to make sense. And then in the long term, we're talking like 6 months, it was a combination of flexibility and mixed exercises. So a little bit of everything. So my takeaway from this, and then this is also aligns with the author's takeaway, was that when it comes to the short term and immediate, start doing some like low impact aerobic exercises. Personally, I would do that in addition to what I call kind of like lighter strengthening exercises where we're not putting the knee in too much danger, in addition to like mobility and flexibility exercises. And then as you're transitioning and your pain is decreasing, your confidence is increasing, we're going to add in some strengthening stuff and eventually be doing a little bit of aerobic, a little bit of cardio, a little bit of mobility, and then a little bit of the strengthening stuff. So basically there's not one exercise intervention that works better than anything else. They all work pretty well. And it goes against the whole myth of like, hey, running is bad for your knees. Actually, it's like pretty good for your knees as long as you're scaling up correctly. And the other thing is strength training, flexibility, very important. And overall, just like movement is medicine, right? You have 15,000 people, was it 200 something studies? So this is a pretty big win for the Exercise is Medicine camp, aka us. If you have very minimal time, start with that low level aerobic stuff. If you're ready to kind of take on a little bit more, honestly, the mixed intervention is great. So cardio, mobility, strength, and even some coordination stuff. So there's some evidence for everything we're about to say after this. But let's get into kind of the nitty gritty. I think like one of the biggest issues, Ryan, that I see people have when it comes to knee pain is just, they get that advice like, hey, if you have knee pain, strengthen your legs. Well, how am I supposed to strengthen my legs if my knees hurt like hell? So I know you're an expert at that, and you've worked with probably hundreds of people at this point with that exact problem. So how do you go about solving that?
Yeah, it's like when you go to a doctor and they tell you like, all right, well, eat healthy and exercise. You're like, all right, sick. What? I didn't know that.
Thanks.
Yeah, I was gonna say with that study, like it makes sense. You said that like the short term, what really helped in the immediate short term group was like that aerobic. And that makes sense because it's like the endorphins are firing, the blood circulation to that joint. So it's almost like maybe the analogy of like the Band-Aid isn't the best, but it helps, right? But then the long-term interventions, what really helps, like the root of the problem is like what we advocate a lot for is that strength training and like mobility and stretching and stuff. So that makes sense. But yeah, to be a little bit more specific on how to exercise around the knee pain is we could also use the story of Alexandra, our client, when she had that knee pain, like when she was running. And so her initial, thought was like, okay, I'm going to take a break from running, but she didn't stop there. She just didn't completely stop and like give up because running is important to her. And with your example of Biz, playing hockey is important. So she's like, I'm not going to just stop playing hockey because it's causing knee pain. I'm going to do something about it. If there's a will, there's a way. So a big kind of theme of what we're talking about is a lot of people just, stop or they're told to stop. But a lot of the times, all we got to do is like come up with a plan, do some certain exercises, manage load and volume. And so specifically, you actually brought this up earlier, Milad, as you said that kind of like a 5 out of 10 pain rule. So if something is hurting, extremely, okay, maybe we'll refer you out and we'll talk a little bit more about that too. But if it's under a 3 out of 10, first rate your pain. If it's under a 3 out of 10, we can modify some exercises. So that it would be another principle is like modifying your exercises so we can regress certain movement patterns and kind of like start from the top. So basically what you can think of exercises, you can kind of put them into categories. So like we have squats, we have deadlifts, we have like a split squat or a lunge. And so each of those categories of movements, we have different tiers of exercise complexity. One that is more complex, one that is like really not like a simple exercise that is easier and less risky. So that would be a good idea to look into and modify some certain exercises when you are exercising around that knee pain. So specifically with your knee joint, with that knee extension, which is basically like kicking out your knee and straightening out your knee, it would be a good idea to strengthen the top range of that early on. So what I mean by that, so some specific examples is something called a sled drag. And not everybody has access to this in like commercial gyms, but when I was working at 24 Hour Fitness, they had a sled. And it's that thing that you see a lot of people like putting weights on it and pushing it. But what you can do is you could actually drag it. So it'd be the reverse of pushing it. So you put weight on it, or you could start with no weight on it. And you take basically ropes and you attach it to the sled and you walk backwards. So that is an example of that top range strengthening of the or the knee extension. Not everybody has access to a sled. Another good exercise for that top range strengthening of that knee extension is a side low box step up. That's a really good exercise. And once you get good at that one, we have a heel elevated step up. Then we have a pistol squat, but just the top range. So what I do with one of my clients is I set up a bench and put it all the way inclined, not all the way inclined, but just right under your hip. And we basically do a single leg squat, which is called a pistol squat. And that's just, again, what we're doing is we're just strengthening that top range, basically of a squat or that knee extension. So we're just trying to strengthen that knee joint in like a very low range of motion. And again, what we're talking about right now is trying to exercise around that knee pain and kind of address the issue and modify some exercises. So these are just some examples. Next, you get good at these things, you get good at the top range, and maybe we can go to the bottom range of that knee extension. So now we have exercises like a front foot elevated split squat. We have just a normal split squat, so we take away that front foot elevated. We have a rear foot elevated split squat. So in a nutshell, the point that I'm trying to make is we can regress some movements to less complex if we're trying to exercise around that knee pain. Another point is to prioritize movement before we load the tissue with like external weight. What I mean by that is always prioritize your form and technique, really master the movement before we go super heavy. And so that looks like, having consistent tempo over time, just becoming confident with that exercise. So I went through a bunch of regressions and progressions. Like really take your time with it. You might be there for a month before you progress to the next progression of exercises. So that's another point. Always prioritize form and technique before adding load to the tissue and loading up the bar. Things to avoid, keep it super simple and just, if something is really hurting you, that might be a good indication of modifying that exercise. And it is a little nuanced because what we were talking about earlier, you got to ask yourself some questions. How painful is this movement? How long is the pain lasting? And so if there is a problem that is like that pain is lasting for a while, okay, maybe, avoid that movement and regress it to an easier exercise. Similar, we're still working the same muscles, but just a regression. But yeah, that in a nutshell is what I would say, that's how we train around knee pain initially. But ideally, we do want to kind of like fix the root of the problem. And so Milad, what are some things that we can do to really get to the root of that problem and kind of fix it?
Yeah, for sure. And those were like solid tips for training around knee pain. And feel free like also to do other stuff while you're training around the knee pain, like upper body, core, anything that feels good. Just go ham on it. Doesn't mean that you have to be inactive. And yeah, when it comes to rehabbing the achy knees, I think like ideally you see someone in person just to fully, cover your bases. Whether that be a physical therapist or like a kinesiologist who's like an expert in pain management. But if some people don't have access to that, or, money is an issue, this is how I would go about rehabbing or fixing the knee. It's going to work for most people, but sometimes you really do need to go see someone depending on the severity. So just keep that in mind. High level view, we're going to be focusing on 3 levels, right? So the first level, and you can think of each level as a time frame, right? So each level can last anywhere between 4 to 12 weeks. If everything goes great, 4 weeks. If everything takes a little bit longer, you're a little bit older, you're deconditioned, you're not as healthy, might take a little bit longer. But the first level is reducing pain symptoms. So we have to basically decrease your pain via modifying aggravating factors. So whatever is causing the issue, we need to scale it back by at least 25%. Then we need to do some stuff that'll decrease pain. So that's typically like what you did with Alexandra. It's like soft tissue mobilization, whether you getting a massage or doing self-massage through foam rollers, massage guns, things like that. Do some aerobic exercises to increase blood flow, circulation, improve your mood, get better sleep. And then also doing light flexibility, mobility work, plus some of that lighter strength stuff. After that phase, when you notice a pretty good amount of pain relief, we're going to go into the next level, right? So we're going to start addressing impairments or deficits caused by the pain. So when you are in pain, it's going to inhibit certain muscle activation and can impair your ability to move. So as your pain improves, you're going to need to implement more mobility, more movement. And we like to start with eccentrics and isometrics. So these are very like big bang for your buck exercises, right? Eccentrics, isometrics, because they usually make your pain better and they can strengthen your tendons, your muscles, your bones all in one go. So this is kind of like the biggest bang for your buck. And then we're also going to continue the mobility stuff and the strengthening stuff we've been doing. Then we're going to go on to the last level, which is we're going to continue to build capacity, prevent flare-ups by strengthening your body. So like at this level, the pain is pretty minimal and you're doing things like full range of motion squats, full range of motion split squats, you're running, you're doing high impact stuff, but again, you're slowly scaling it up because you've spent the last 8 to 24 weeks getting to that position. Now, specifically what that looks like is you're going to work on your mobility, you're going to work on building tendon resilience, you're going to work on strengthening your quads in addition to your posterior chain, your lower limbs, your adductors, and scaling that as much as you can. So when it comes to mobility, we really want to focus on your spine mobility, starting at that mid back, going all the way down to the lower back. And then we want to focus on improving your hip mobility. Probably one of the biggest ones, hip and ankle, when it comes to how they affect the knee. So I always just do like a shotgun approach for the hip. So just improve your internal, external rotation, hip flexion, extension, your inner thigh, your adductors, all that stuff. You want to be working on all those things at the same time. Same with ankle mobility. Like you should be able to get your knees over your toes by about 3 inches without your heel coming up. If you can't do that, your calves feel super tight, then that's something you need to work on. So we have a ton of mobility stuff. I'm not going to sit here and tell you every single exercise, but like if you want a great kind of starting point, we have a really good 12-week knee strengthening program that includes mobility, stability, isometric, eccentrics, and it follows that 3-level approach. Moving on to tendon resilience. So oftentimes people have pain at the bottom of their kneecap or the center of the kneecap or at the top of the kneecap. That's usually your quad tendon or your patellar tendon. And the best way to heal your tendons is through isometric and eccentric exercises. Again, we have a ton of videos on that, but basically what an eccentric looks like is if you're doing a squat, you're going super slow on the way down. And what that does is that it's shortening your quad under load while stretching the tendon. And tendons, if you don't know, they connect muscle to bone. So there's a quad tendon that connects your quad tendon to your patellar bone. The patellar, the floating bone in your kneecap. So as your quad is contracting under load, that pulls on that tendon very slowly, again, under load, and that tells your body to start creating more tendon resilience in the form of collagen repair and collagen synthesis. It takes a little bit longer than like muscle strains, things like that, but it really does help. It just takes a while and it can be painful, but again, follow that 5 out of 10 rule and make sure it doesn't carry on after the set or into the next day. In addition to the eccentrics, the isometrics are going to hold. Just think about wall sits. Same thing, like just sit in a wall sit 45 to 90 degrees. 45 degrees is more than enough. So if you can't bend your knees too much, that's totally okay. Hold for 30 to 45 seconds. Same thing is happening. You're stimulating collagen synthesis. Collagen is the protein that's in charge of building basically the tissue of the tendon. So you're increasing that and allowing the tendon to take on more load. And then just doing some good old-fashioned strengthening of your glutes, your hamstrings, your inner thighs, your calves, your tibs, um, even your core. So again, your body is this whole system, right? And the more you can strengthen all of the muscles surrounding the joint, the better that joint is going to be in general. And you can kind of refer back to Ryan was saying some of the exercises we use there. I really like Romanian deadlifts, hamstring curls, side lying hip abduction, bread and butter. Eventually do a side plank with side lying hip abductions, tib raises, calf raises. Again, all this stuff we have on a bunch of our videos. The first big YouTube video we're releasing is actually gonna cover all this, so it's pretty important. So that's basically it, right? So you want to start with getting those pain symptoms to decrease by aerobic activity, foam rolling, and very light stretching, mobility, and stability work. Then we want to start implementing eccentrics and isometrics in addition to the other stuff. And then once the pain is at like a 3 out of 10 and you don't really even notice it, that's when you want to start doing full range of motion squats, Romanian deadlifts, elevated heel raises, things like that. And just basically it starts looking like strength and conditioning. You're doing box jumps, you're sprinting, you're doing all that stuff. You just want to keep building capacity and resilience as you move on up. If you have any questions on that, let us know. Drop them down below. And if you want a framework, again, check out the longevity app. There's a 30-day free trial in the description, and we have a really great 12-week knee strengthening program that covers all of that stuff. And again, when it comes to rehabbing, understand that your body is resilient. You're going to have good days, you're going to have bad days, but as long as you keep showing up, you're going to get better. And that's the most important thing. Growth mindset when it comes to all this stuff. Yeah, anything on the rehab process that you would add, Ryan?
No, I think you did a great job with laying all that out. But now we're at the point where we have exercised around the knee pain. Maybe you've done some rehab that Milad just explained. And so now we're at the point where you're like, okay, my knee is feeling good. Or maybe you just want some tips on how to strengthen your knees in general. So what I'm going to do now is I'm going to give you some categories. I put exercises in categories. And then what I'm going to do is give you progressions and regressions for that movement pattern. And Milad, feel free to add any like exercise modalities to this. So when I'm done, if you have any additional exercises, or maybe you would progress or regress a little bit differently, just let us know. So the categories that I put out, we have knee extension, which is what I talked about earlier. It's like flexing the knee and straightening out your knee. So if you're sitting down on a chair right now, just like kick your knee out. So that's knee extension. The opposite of that is knee flexion. So think if you are standing up straight and you hit yourself with your heel to your butt, that's knee flexion. We have squats. We have hip extension and flexion. It's basically moving your hips back and forth. And then I would say calf raises, throw those in there too, because it's good for your knees as well. So let's start from the top, knee extension. And again, what I'm doing is I'm starting from kind of the easiest to more advanced. And the good thing about these progressions is you can slide up and down on the complexity scale. So let's start from the top of knee extension. Remember, knee extension is straightening out your knee. And top of the progression or regression rather, sled drag. So that's sled drag. Not everybody has access to that, but I explained it earlier. Next up is side step up, but like a low box. So very low box, not too high. A common mistake is like just right off the bat, if you have knee pain, like doing it at like a bench. So we want lower, something like 2 or 3 inches. So it's a low box side step up. Then we have a heel elevated step up, so a normal step up. So now the box is in front of you, but you're elevating your heel. So you put, if your gym has like a heel elevation, that's ideal. But if not, you put like a weight, or if you're at home, you put like a textbook down on top of the box. So you're elevating your heel and you do like a forward step up. Then we have a pistol squat, but that top range. So it's like basically a single leg squat, but very low range of motion, just that top range of that knee extension. Then we have a full step up, like a full front step up. So now we're elevating that box now. So now we're doing it off of a bench, for example. Then we have a front foot elevated split squat. And then we have take away that front foot elevation and just a normal split squat. And then we have a rear foot elevated split squat. So that's knee extension. And remember, these exercises are good for knee health. Next, we have knee flexion. So that is hitting yourself in the butt with your heel. So what I like to do, I like to start people off with a Swiss ball roll-in or like a yoga ball roll-in. Then we progress to like a foam roller. So now you're using a foam roller. So you're on your back, your heels are on a foam roller, and you're curling that in using your hamstrings. Then if you're in a gym that has a standing leg curl machine, use that. Then we have a lying leg curl. So if you're in a gym and you have a lying leg curl machine, you can use that. If you're at home, you can do a dumbbell variation where you put the dumbbells in between your feet and curl up. And then we have a seated leg curl variation. So that's knee flexion, good for knee strengthening. All right, let's talk about squats. So the progression regression that I have for squats is I like to start off, depending if we want to load it up, we might do some body weight stuff here and there, but in general, we have a heel elevated goblet squat. That's when you take a dumbbell, you're holding it in front of you, your heels are elevated and you squat up and down. Take away the heel elevation, that'd be the next progression, so just a regular goblet squat. Then we can progress and maybe do a heel elevated front squat. So whether that be with a dumbbell a barbell or a dumbbell, just holding a load in front of you. Now the barbell is on your shoulders, heel elevated. Then take away the heel elevation, and so now we're doing a barbell front squat. Then we have a barbell heel elevated back squat, and then take away that heel elevation and just do a regular back squat. The cool thing too is like, you don't have to go all the way through this progression. You might end up like just staying at the front squat, and that's okay. You might stay at that heel elevated goblet squat, and that's okay. It's just what I'm doing is I'm giving you tools to progress exercises and maybe regress them too. So that's squats. Next, we have hip extension, so using your hips. So we have bridges. You could do dumbbell bridges, you could do barbell bridges, and then a single leg bridge. Next, we have a single leg Romanian deadlift. Then we have a hip thrust. So you could do a dumbbell hip thrust or a barbell hip thrust or just body weight. Then we have a normal Romanian deadlift with a barbell or a dumbbell. And then we have good morning variations where you have like a load. It's usually with a barbell on your back, but you could also do either a plate or a dumbbell in front of you. And you can do, good morning is basically, it's kind of like a deadlift, but you have a load up top now, not at the bottom. And so you could do that seated or you could do that standing. So that is hip extension. Then we have some calf raises stuff. So you could do a standing calf raise or a seated calf raise. But that, yeah, in a nutshell, is some progression regressions with all those movement categories. Yeah, Milad, would you add anything? Would you modify anything there?
Those are pretty solid. I think what I would also add is lateral strengthening movements. So lateral lunges, basically that's a big one. Any lateral lunge, kettlebell lateral lunge, whatever you got, that's a good one. I think once you're feeling really good, add in some basic plyometrics. I think everyone should be able to jump and land from a jump and hop. So just basically hopping up and down, forward and backwards, laterally, box jumps, depth jumps, kettlebell swings. Once you're feeling more comfortable with the knee, add in some plyometrics, because that's one thing that we definitely lose as we age, and it's something that we lose relatively quickly, is our power. So strength, muscle mass, we definitely naturally lose if we're not training those, but power goes away super quickly, and you want to be able to retain some of that as you get older. So I would do some light plyometrics. And again, maintain your cardio, or at least have some sort of cardio practice, whether it be running, hiking, cycling, or walking with a weighted vest, swimming, all that stuff. And then this one is like extra credit. If you're feeling athletic, add in some sprinting, add in some really high impact, high intensity cardio work too. It's case by case. I think if you're just trying to train for longevity, some sort of sprinting or high intensity running should be into it in your program. It's in our longevity program, or some biking. And And if you have like a certain sport that you're playing, it could be pickleball, tennis, I mean, whatever, whatever you're training for, make sure you're doing that skill training at a high intensity as well. And I think another big thing people tell us, or we get in the comments of our posts a lot, is like, okay, this is all great, but when do I do the prehab, or when do I do the rehab stuff? And I think, general rule of thumb, like this is the gold standard, is do your rehab, prehab, mobility work just before you start your training. So basically do a dynamic warm up, world's greatest stretch, hop on the rower, hop on the bike for a little bit, just get the body temperature up, get the blood moving, get the circulation going, and then do your prehab work. So that could be your wall sits, your eccentric stuff. It could be your side lying hip abduction, 2 sets for 45 seconds on the wall sits, 15 reps on the other stuff, and then go into your main lift. Don't overcomplicate it, and then if you have time, you can do static stretching at the end. That's ideal. And you don't have to do the same one every day. So maybe like on your second day of working out, you're doing other isometric and eccentric exercises, or you're doing more posterior chain work, or that's when you do your calf raises, your tip raises. But basically, like, you don't need to spend hours on this stuff. If anything, 3 times a week, 15 to 20 minutes, depending on what's going on. So that's the biggest thing. And I know, Ryan, sometimes you like to kind of toss that into with supersets. You've done like the stretching supersets. We've done that too. So if you're doing like an upper body day, with your push-ups, do wall sits. With your bicep curl to press, you're doing your side lying hip abduction. So just sprinkle it in wherever you can. And then worst comes to worst, just do it while you're watching Netflix at night, because it doesn't take that long. Any tips there when it comes to how you should incorporating your rehab and injury prevention stuff into your daily life?
Yeah, you could, if you're setting up your workout, you could also do some of those stretches included in your warm up. So let's say like if you're struggling with like shoulder flexion, like I do, and you have like a shoulder press later in the day that requires a lot of that shoulder flexion, you can start off your workout with some of those stretches that we were talking about, like shoulder flexion stretch. And then your lift will be more effective later on in that workout. So we do like different things. It depends on what's going on and how we want to program stuff. It's case by case, because we have certain programs that we're pairing an exercise like a resistance training exercise with a stretch, or we do a lot of stretches early on in the workout and then get to the meat and potatoes of the workout. So plenty of different ways.
Yeah, 100%. And don't let anyone tell you that you can't stretch before a workout. That's one of my biggest pet peeves. That's how you know that someone is a very inexperienced coach or practitioner or whatever. If you're like, don't stretch before you work out. I will say this, okay, if you're doing a very high intensity, like if you're going to be sprinting or doing like medicine ball wall passes or something, don't stretch, because that's going to decrease your force output.
Or going for a PR.
Yeah.
Yeah.
But if you're just like lifting for longevity and you're just lifting and you know that you have some sort of movement deficiency, feel free to stretch. I do it all the time. Ryan does it all the time. And we're still hitting PRs. We're still building muscle, and we're definitely not really getting injured. And our injuries aren't because we're stretching before. If anything, it's helping us with our range of motion. So yeah, I know that's controversial, but that's a hill I'm willing to die on. Okay, I feel like that sort of covers it. I mean, the knee pain stuff, there's a whole rabbit hole, and I think we'll probably do a whole podcast dedicated to it. But I think when it comes to training your knee for longevity, that's a pretty good place to start. Biggest thing to realize is that knee pain happens to most people, and it can definitely be managed, more than likely fixed, and it requires a little bit of training around the pain, some specific rehab stuff that is gradually built up over time, and then just getting strong and getting fast. That's the biggest takeaways. Any life updates or anything non-knee related that you want to mention here, Ryan, before we log off?
Yeah, I was talking to you the other week, talking about how I got to get back into reading books. Um, so what I was doing previously is I would get my steps on a treadmill and I would watch like fantasy football YouTube videos. Now that that's over and done, um, I've been getting back into reading. So the book that I'm reading right now, or it's audiobook, is The Five Types of Wealth: A Transformative Guide to Design Your Dream Life by Sahil Bloom. And so far it's good. The five types of wealth is time, social, mental, physical, and financial. Because like a common mistake is what people think is wealth is just the financial part. And so this book is kind of diving into like the five different types of wealth and like how you can maximize them and work on them. So it's good so far.
Hell yeah, I love that. I like Sahil Bloom. I've seen just some of his stuff and read a lot of his like long form stuff. I forgot what business he sold. Do you remember?
No.
He sold a business, like that's how he's like made his money. It's like a pretty famous business. But yeah, that's cool. Yeah, I love that. I should probably check that out. I mean, I think like one thing I've been realizing is I have been working a lot more on the weekends than I usually do, and I feel like it's kind of making it hard to like enjoy some other stuff. And then I kind of realized like, yo, like you make your own schedule and you have your own business, so you should modify that. And then also, I think that I need to take more breaks and enjoy that the social wealth and the other types of wealth that having your own business creates. So I've been trying to take at least one full day fully off. Still a bit of a challenge because I like work and I like working, but I know that like taking that day off will actually improve my work. So it's kind of an interesting thing.
Yeah, it's
Um,
also phases of life and like what season of life you're in. So sometimes you're going to prioritize a lot of business, and then other times you're able to prioritize that play and stuff. Um, so yeah, seasons of life.
100%, man. Yeah, I've been reading. I've been cooking a lot. That's been my thing. So I've been reading Salt, Fat, Acid, Heat. I read some of
Nice.
it. Have you heard of this book?
Yeah, I don't know if I finished it, but yeah, I have it and I've read some of it for sure.
Great book. It's just like a kind of like from the ground up, teaching you the fundamentals of good cooking. Like the goal is for you to just be able to create something delicious based off of random ingredients. And so like there's recipes in there, but they're designed in a way to help you kind of explore cooking and different flavors and seasonings and things like that, which is really cool. Like I'm like inspired by the book because I kind of want to create like an exercise version of that. Because ultimately, like when you understand the fundamentals of exercise or even nutrition, you can create your own programs like that. They may not be the most optimal program, but they're fun and creative. So, yeah, that's been cool. It's been like a big stress reliever, and it's like I imagine, you know how there's a lot of people who love to lift and love working out, but it's not their job and they didn't go to school for it. Like maybe they have a corporate job and then they get really into it. Like they're reading papers and they're getting super sciencey about it. I feel like I'm doing that, but with cooking. And it's cool. It's cool to have it. So
Yes, it is an art form. And yeah.
yeah, when I come to Boise, I'm gonna make you and Gabby something delicious. At least a
Oh
couple
yeah.
of delicious things. Yeah.
Yeah, sick. Looking forward to it.
Nice, dude. All right. Well, I think that's it from us. 12-week knee strengthening program and a shit ton of other stuff in the Longevity app, 30-day free trial in the description below. If you feel like you resonated with either Biz's story or Alexandra's story and need some help with knee pain stuff or just anything fitness, pain management, or nutrition related, hit us up. One-on-one coaching down below. And we hope you have a great week, day, whatever, wherever we're at, whenever this comes out.
See you guys.